This video provides directions on the application and use of the Coloplast Fistula Wound Management System. The intended use of the product is to manage patients suffering from fistulas in the abdominal region. The fistulas may be multiple, may be situated in an open wound, or close to an ostomy. The product is for single use only. The system consists of a transparent cover sheet, a tracing guide, the Fistula and Wound Manager, which has an inflatable ring positioned under the coupling. The system also includes a pump to inflate the inflatable ring, a flexible lid, a drain port, and a clamp. The system is available in 3 sizes. The Midi and Maxi systems have 2 outlets, while the Mini system has 1 outlet. The outlets have an anti-reflux valve, which prevents backflow of drainage into the pouch. To get started, place the transparent cover sheet over the fistula or wound to prevent contaminating the tracing guide. The pouch can be placed horizontally or vertically. The tracing guide is uniquely designed to ensure accuracy when cutting the fistula or wound pattern. To make sure the guide is on the correct side when tracing, you should be able to read "Draw this side" from left to right. Before tracing, make sure the diagram on the guide is facing the same direction the outlets will face when the product is applied on the patient. For example, if you apply the pouch with the outlets facing the patient's feet, the diagram on the tracing guide should be in the same position. Use a felt tip pen to trace the fistula or wound onto the tracing guide. Do not trace into the blue no-cut zone. When tracing, remember the adhesive should not overlap the fistula or wound. To position the tracing guide on the back of the adhesive, bend the tracing guide at the dashed line and remove the small release liner. Adhere the top of the tracing guide, matching it perfectly to the flower edge design. At this point, the tracing guide can be repositioned if necessary. Flip the tracing guide upward and remove the large release liner as you adhere the guide to the back of the adhesive. At this point, you should not be able to read "Draw this side," and the diagram on the pouch should be facing the way the outlets will drain on the patient. Cut the tracing of the fistula or wound into the adhesive. Do not cut into the blue no-cut zone. Before applying the system, close the outlet spouts. Remove the large release liner first to prepare for application. If needed, there is a small clear release liner to grasp while applying the system. Remove all release liners prior to application. Apply the system to the edge of the wound starting at the base of the wound and working upwards. Apply the rest of the adhesive by smoothing from inside to out. Apply gentle pressure. The adhesive is designed with cold flow adaptability to ensure a good seal. The inflatable ring is located under the coupling. This inflatable ring stabilizes the product and helps prevent leakage. Use the blue pump to inflate the ring. Gently pump until you feel resistance. You can assess the amount of air in the ring by pressing down as you inflate. As you remove the pump from the outlet, squeeze the soft part of the outlet. Secure the top of the lid on the coupling by removing the top portion of the backing. Apply the lid on the coupling. Remove the remainder of the paper backing. Make sure you have a good seal. For best results, do not stretch the flexible ring during its application. If the adhesive of the lid gets wet, you need to consider applying a new lid for security. The system comes with 1 flexible lid. Coloplast also sells lids in boxes of 10 in all 3 sizes. Make sure to clean the coupling before reapplying the lid. Return the lid to the coupling and secure. If you are using a drain port, you will need to prepare the lid prior to application to the coupling. If you are using catheters ranging from 18 French to 22 French, the drain port is ready to use. For catheters ranging from 24 French to 30 French, you will need to pull off the top of the drain port. Do not cut, as this may prevent a secure seal around the catheter. You need to pull firmly. Remove backing from the drain port and place on the lid. Turn over the lid and cut a hole in the lid in the center of the drain port to allow the catheter to be threaded into the pouch. Lubricate the catheter with water and twist it through the drain port. Make sure the drain port collar and top, if not removed, is pressed all the way in. This ensures a secure seal around the catheter. Once the flexible lid is applied to the coupling, the catheter can be better secured. A separate fistula drainage bag can be purchased. This allows for constant drainage of the pouch. It is important to use the Coloplast fistula drainage bag with the system, as it is designed to fit the large outlets. The bag tubing has a number of joints. Each joint can serve as a connector to the fistula and wound system. If shortening the drainage tube, take the end of the tube and match the ridges, then cut. After cutting, insert the outlet valve into the tubing. If only one outlet is going to be used, the other can be clamped off. Do not cut off the outlet chambers, as this will affect the pouch's integrity. For more information on the Coloplast Fistula and Wound Management System, or to start an evaluation in your facility, please visit www.us.coloplast.com/fistula or call 1-800-788-0293. You can also contact your local ostomy specialist.